Hey, this is Mark again with Blue Water. I'm going to talk to you today real briefly about the only 6 things that employers can do to control their healthcare cost. There's a lot of things out there and employers get very confused, my clients included, so I've always found that it's helpful to go back to the basics and talk about the only 6 things, the categories of things that employers can do to control their actual healthcare costs. We'll just get started. Number 1, the plan. You can change the plan. Now, changing your plan has 2 impacts. The first impact is a bit of a cost shift from the plan, the insurance carrier, or if you're self-insured, you as a company, to the employee. The other impact is that it will change your utilization to a certain degree, in that if it costs an employee more to get services, then they're going to use a little bit less of it as far as economics go, all things being equal. So that's the first thing that a lot of employers do to control their healthcare costs. Number 2, you can change what the employees pay. Now, that portion of it is a pure cost shift to employees. My philosophy on benefits on this is to be very careful, because there's a right and a wrong way really to do 1 and 2, plan design and employee contributions. You really need to do that based upon good data, based on good benchmark data that gives you an idea of what people are doing nationally as well as what people are doing locally and in your industry so that you can stay competitive. The other thing in regards to employee contributions, my personal opinion is that I'm a bigger believer in changing the plan than changing employee contributions for this reason. If you change the plan, you only impact the people that use the plan. If you change your employee contributions, you impact everyone. And the worst thing that can happen is doing an employee contribution to the plan change inappropriately. You'll begin to shift off your healthy risk off of the plan, which creates adverse selection and actually higher healthcare cost over time. So changing employee contributions is a good thing to do, but you have to be careful with it. Number 3, you can change vendors. You can change TPAs, insurance carriers, disease management vendors, medical insurance carriers, TPA claims administrators. Those are different things that you can do in order to shop, obviously, the market to make sure you have the most competitive pricing. And that leverage proves continually to be very effective for employers in helping to lower their healthcare costs and get their vendors, and specifically their fully insured carriers and stop-loss insurance carriers, to take more risk in their plan, which means that the premiums are lower. Number 4, you can change the funding. Now, I lose a lot of employers on when I begin to talk about funding because immediately they think about self-insurance. Hang out with me just for a second. When funding really means all different types of funding. You can be fully insured, you can be fully self-insured with even no reinsurance. And there are 1,000 places you can be on that continuum. There are minimum premium contracts, there are tightly insured, self-insured contracts, there are one-way retrospective agreements, there are participating fully insured programs, and there's also ways that you can use accounts such as health reimbursement arrangements, HSAs, to take additional risk in the plan and shift the funding around. The question becomes, who does it make the most sense to pay for certain parts of your medical plan? And oftentimes by tweaking the funding here or there, depending upon the size of your company and the risk that you're willing to take, you can pick up 3 to 5% of your overall cost just simply by the way that you pay for it. Number 5 and 6 are, as of now, March 2010, the big 2 areas that the vast majority of employers are focusing on, because honestly, most people have focused on 1, 2, 3, and 4 to a lesser degree for the last decade and a half. But the last 2, eligibility and population health management, present some opportunities for you as an employer. Now, on eligibility, your first question will be, well, how can changing my eligibility do anything? If the person's already on my plan, then obviously that's not going to help with my cost. And that's true. When we're referring to eligibility, mainly what we're talking about is ensuring that the dependents, the spouses and children that are on your plans currently, are actually eligible to be there in the first place. As we begin auditing these, you'll find that on average, nationally, between 8 and 12% of your spouses and children aren't eligible to be there. Now, when you figure that each one of those costs you between $2,000 and $2,500 per member per year net to you as a company, outside of employee contributions, this is a huge area of opportunity for savings in a company. Here recently, I read a study of a municipality with 1,000 employees that saved over $1 million by simply removing the people who weren't following the rules. Now, the people that don't follow the rules, you have to do it in the right way and make sure that you provide a way for them to get coverage. But ultimately, not doing it impacts all the people that are following the rules. So I really encourage you to take a look at that. And finally, population health management. Ultimately, the healthcare cost equation is pretty simple. It's the utilization of services times the cost of those services is the overall total cost. And then those calculations for you as a company end up playing into what your overall premium is if you're fully insured, and if you're self-insured, it has a direct impact to you. So the main thing to understand is that your claims determine your premiums, even if you're fully insured, and the healthier your population is, the less claims they have. Now, population health management refers to disease management, wellness efforts, targeted, actually functional wellness programs. It's funny, when you read surveys, you'll find that 90% of employers claim to have a wellness program. However, when you begin talking with them about that, by wellness, they may mean sending out a flyer with a paycheck, which is not a wellness program. I'm talking about results-based wellness programs. And there's huge opportunity for employers who are willing to get their hands dirty a little bit and focus on reducing the overall health risk of their population over the long haul. Because if you're able to use those efforts to cut your trend a little bit, then you can be successful in controlling your healthcare cost. Recently, one of our clients over the past handful of years measured, and they found that they were able to control their healthcare cost for no increase over the last 5 years, because they've really gotten their hands dirty in this area and gotten very creative about ways that they can control the health risk of their population. So that's the 6 ways that you can control healthcare cost, and we drilled down further in other parts of our blog into different sections of this, so take a look around, and I hope you enjoyed it.